Retinal detachment is an ophthalmologic disease. Look at this picture, shows that normal eye and retinal detachment eye and ultrasound findings. Look at this detail going on. Introduction. Retinal detachment is a serious eye condition where the retina, the light sensitive layer of tissue at the back of the eye, pulls away from the underlying tissue. This separation disrupts the retina's role in visual processing, and if left untreated, it can lead to permanent vision loss. Prompt medical intervention is crucial. Definition. Retinal detachment is defined as the separation of the retina from the underlying retinal pigment epithelium and choroid, which supplies oxygen and nutrients to the retina. This leads to a lack of essential blood flow to the retina and consequently a risk of vision impairment. Types. 1. Ahematogenous retinal detachment. The most common type caused by a tear or hole in the retina, allowing fluid to seep underneath, leading to detachment. 2. Tractrinal retinal detachment occurs when scar tissue on the retina's surface contracts, pulling the retina away from the back of the eye. It is commonly seen in people with diabetes. 3. Exudative retinal detachment occurs without a tear. Instead, fluid accumulates under the retina due to inflammation, injury, or disease. Causes. 1. Aging. The vitreous gel in the eye shrinks with age, which may pull on the retina and lead to detachment. 2. Eye injury. Physical trauma can create tears, leading to detachment. 3. Previous eye surgery. Surgeries like cataract removal increase the risk. 4. Diseases. Diabetes, retinopathy, severe myopia, or inflammatory eye diseases may contribute. Risk factors. 1. Age. Individuals over 50 are at high risk. to severe nearsightedness, myopia, increases susceptibility to retinal tears. 3. Previous retinal detachment. If one eye has been affected, then other is at risk. 4. Family history. A family history of retinal detachment raises personal risk. 5. Chronic conditions, diabetes, retinopathy, and inflammatory disorders like uveitis. Complications. 1. Permanent vision loss. Detachment can lead to blindness if untreated. 2. Redetachment. Post-surgical redetachment can occur, requiring further intervention. 3. Infection. Surgical procedures risk. Infection potentially leading to further complications. Pathophysiology. The retina receives nutrients and oxygen from the underlying choroid layer. When the retina detaches, it loses their connection, leading to ischemia and potentially permanent damage to photoreceptor cells. In rheumatogenious detachment, the detachment process is triggered by various humor leaking through a tear, while in tractinal detachment, fibrous tissue pulls the retina away from the choroid. In exudative detachment, fluid accumulates due to underlying disease. The pathophysiology of retinal detachment is a sequential process that varies slightly based on the type of detachment. Here is a step-by-step breakdown focusing primarily on the rheumatogenious retinal detachment. The most common type: 1. Bedford's degeneration and liquefaction. 2. Posterior Bendrer's detachment, PVD. 3. Formation of retinal tears or holes. 4. Seepage of vitreous fluid through retinal tear. 5. Progressive retinal detachment. 6. Ischemia and photoreceptor damage. If left untreated, the ischemia leads to reversible damage, causing permanent loss of vision in the defected areas. Underlying this step-by-step process highlights the urgency of treating retinal detachment to prevent reversible vision loss by restoring retinal attachment and blood flow. Signs and symptoms. 1. Sudden appearance of flutters dark spots or string in the vision field, 2 flashes of light often described as seeing stars, 3 shadow or curtain over part of vision. Progressing detachment leads to a curtain or shadow effects in peripheral vision. 4. Blurred or distorted vision. Objects may appear out of focus. 5. Loss of peripheral vision often progresses to central vision loss if untreated. Diagnosis. 1. Ophthalmoscopy to examine retinal tears or detachment. 2. Ultrasound imaging used when the retina cannot be seen directly due to opacities in the eye. 4. Optical coherence tomography (OCT) provides detailed cross-sectional images of the retina. Nursing diagnosis. 1. Risk for impaired vision related to retinal detachment. 2. Anxiety due to threat of vision loss. 3. Knowledge deficit regarding the conditions, treatment options, and self-care. 4. Disturbed sensory perception due to changes in vision. Management. First, medical management. 1. Laser surgery to seal retinal tears with lasers. 2. Cryopraxy uses extreme cold to scare the area around a tear, sealing it. 3. Pneumatic retinopraxy, a gas bulb is injected to push the retina back to place. 4. Scleral buckling surgery. A silicone band is placed around the eye to relieve the pull on the retina. 5. Vitrectomy, removal of the vitreous gel that is pulling on the retina. Nursing management. 1. Preoperative care, provide emotional support, educate on the procedure, and ensure adherence to preoperative instructions. 2. Postoperative care, instruct on head positioning, avoid sudden movements, and monitor for complications like increased pain or infection. 3. Education, inform patients on warning signs of redetachment and the importance of follow-up appointments. Treatment. One, laser photocoagulation uses a laser to create scar tissue around a retinal tear to prevent further detachment. 2. Cryopraxy freezes the area around a tear to form a scar and stabilize the retina. 3. Rheumatic retinopathy inject a gas bubbles into the eye to push the retina back into place. 4. Scleral buckling surgery. A band is placed around the eye to counteract the force causing the detachment. 5. Vitrectomy remove the vitreous gel, allowing the surgeon to repair large retinal tears and reattach the retina. Psychosocial medicine. 1. Emotional impact. Fear of vision loss may cause significant stress and anxiety. 2. Support and counseling. Psychological support, including access to support groups and counseling, can aid in coping with changes in vision. 3. Rehabilitation services. Referral to low vision services for adaptive tools and techniques manage vision changes. Prevention. 1. Routine eye examination, especially for high risk individuals, to detect early changes. 2. Protective eye wear during sports or activities with a risk of eye trauma. 3. Diabetes management to prevent complications such as diabetic retinopathy. 4. Awareness of symptoms. Immediate medical attention if signs of detachment appear. In conclusion, retinal detachment is a critical eye condition that requires prompt attention to prevent permanent vision loss. Early detection, surgical intervention, and comprehensive post-treatment care can significantly improve outcomes. Preventive strategies, routine eye exam, and patient education are essential in mitigating risk and managing the condition effectively. Thank you. Have a nice day.